Good evening, guys. Here's your bonus one. Discussion E deals with ankle pain when walking. The title is When Walking, Why They Hurt and What I Can Do. Explores the common causes of ankle pain when walking and offers guidance on managing and treating it. Okay, guys, we're going to go into causes. Causes of ankle pain when walking. Injuries. These include fractures, tendon sprains, tears, ligament sprains, tears, dislocations, and sprained ankles. A sprained ankle occurs when ligaments stretch too far and tear, leading to pain, swelling, and bruising. Okay, overuse. Conditions like tendinitis, fasciitis, and bursitis can develop from repetitive strain, causing persistent discomfort. Medical conditions like arthritis, including osteoarthritis, rheumatoid arthritis, can hold on, I moved. Can lead to ankle pain due to joint degeneration or autoimmune inflammation. Treatment and management. Most ankle pain can be managed with rest, activity, modification, supportive footwear, and over-the-counter pain medication. However, severe causes such as grade 3 sprains or fractures may require medical interventions, including surgery. The best treatments for ankle sprains depends on the severity of the injury. Here are some effective approaches. Okay, immediate care, first 48 hours. Rice method, rest, ice, compression, and elevation. Help reduce swelling and pain. Okay. Second page. Pain relief over-the-counter drugs. Pain relief over-the-counter medications like ibuprofen or naproxen can help manage discomfort. Immobilization, using an ankle brace or bandage can stabilize the joint and prevent further injury. Recovery and rehabilitation. Physical therapy, exercises to restore strength and flexibility and stability. Ankle taping helps support the joint and prevent excessive movement. Gradual activity. Avoid rushing back into sports or strenuous activities to prevent re-injury. Severe cases. Okay. Hold on. I get page turn. Medical intervention in the sprain. If the sprain is severe, doctors may recommend imaging tests, X-ray, MRI to assess ligament damage, surgical repair. In rare cases, surgery may be needed to reconstruct torn ligament. Would you like guidance on specific exercises for recovery? The best treatment for ankle sprains depends on the severity of the injury. Here are some effective approaches. Okay. Immediate RICE, which is rest, ice, compression, and elevation. Help reduce swelling and pain. Pain relief over-the-counter medications like ibuprofen can help manage discomfort. Okay. Immobilization. Using an ankle brace or bandage can stabilize joint and prevent further injury. Okay, severe cases, medical intervention. If the sprain is severe, doctors may recommend imaging tests, X-ray, MRI to assess ligament damage. Surgical repair in rare cases may be needed to reconstruct ligaments. Okay, guys. Give me 1 second, please. So yeah. Okay, here's the question for you all. Would you like guidance on any specific exercises for recovery? So guys, that is your bonus one for the night. Everybody have a good night. I'll see you tomorrow for shows. Take care, Gator Wellness. Have a good night, guys.